twisting it up, securing it, and then there's a little screw here, and then you can tighten it down, and it's just that easy. All right, so it's just a simple tourniquet, but a very important life-saving step. Okay, so massive hemorrhage. Next thing we go on to is airway. Airway is obviously very important, and one of the things that you may have seen before is the nasopharyngeal airway, NPA. And most of the NPAs nowadays are sort of not one size fits all, but they have this nice little donut on here which you can size it to whoever you're treating, okay? And so basically the way you size this is you just look, you take it from the tip of the nose to the earlobe, right? And that's how you measure it on your patient. And so for me, I've got kind of a bigger face, bigger head, and so this kind of, this full size, this 30 size is what's actually going to be effective for me. Somebody with a little bit smaller face, a smaller frame, to be able to adjust it and then use it on them. And it's just as easy as putting this bevel right to the center, starting on the left nostril, right towards the middle of the nose or the septum. Insert it in, it's going to naturally follow the curve of the sinus, and it's just going to slide right in. And this helps keep your patient's airway open by going back far enough in the throat to be able to block the tongue from actually covering the airway. Okay, so NPA and airway. We go on to circulation. Respiration. A lot of things are covered in respiration. We take care of the airway with the NPA, and we want to talk about that penetrating chest trauma. We have chest seals. These are called halo chest seals, and these actually, you may have seen instruments before that had a little vent in them, a little one-way valve. These are actually found to be more effective pre-hospital by having no seal, right? And just because of the adhesiveness of it and the ability to just seal the wound during movement, these have been found to be much more effective and are just, just an all-around great product. And they haven't sold a patent on these, so these are really good to use. So halo chest seals for that penetrating chest trauma, and always they come in packs of 2 because you're always looking for an entry and an exit one. Okay. We go on to circulation. Circulation is covering up all those bleeds, right? And so there we have a variety of things we can use. We can use something as simple as this Curlex gauze to wrap up to help with those field dressings that everybody gets issued or used to get issued. We have these ACE wraps in conjunction with gauze pad that we can use as well to cover up those bleeders. And we also have what's called combat gauze. If you haven't seen it before, it's just a roll of gauze that's been impregnated with a clotting agent to help. So for those deep or really heavy bleeds that you might not be able to get a tourniquet around up in the groin or up in the armpit, that's what this was designed for, to get in there and actually help with the clotting and stop the bleeding faster, and then put more Curlex and things like that on there. Okay? And then we get into that hypothermia and hypovolemia. And hypovolemia, your tried and true, your IV. You've got your fluids, your tubing, and we have these saline lock kits, these pre-packaged kits that a lot of people get now. That are great. They come with a constricting band, this constricting band is also for securing the tubing. Comes with alcohol wipes. It comes with a covering dressing. Comes with your catheter, which is the hypodermic needle with the tubing over top of it, as well as hard needle and syringe. So it comes with a lot of all this in nice one little pre-packaged container, so that way it just helps with all that extra equipment. And then for hypothermia, you always just want to make sure as you're treating the patient, you always want to make sure that you're covering them. So if you're working on one arm, keep the rest of the body covered. You have to go to the chest, cover as much as you can as you're working the patient to try and keep as much of that temperature in as possible. Okay. So knowing the steps of this march, knowing these basic fundamentals, that massive hemorrhage, that airway, respiration, circulation, and hypovolemia, hypothermia, and how to treat them with some basic equipment is very important for everybody to know, and especially with us and how, the line of work we do and where we end up going. So that way you can help your friends come back a lot. Right? Thank you very much for your time. I appreciate it.